Okay. You can start.
Perfect. All right. Hi, everybody. Thanks for joining us. Today is going to be a special case where we do Essence of Medicine, a patient simulation for spine clinic. We have special guest, Cassandra, over here, and she's going to be joining us today as our patient.
And I'm Dr. Abbasi for Essence. So I'm spine. I would say for that to be realistic, pretend I'm not here, Dominic, and then just you see the patient for the first time, and then you get the information, you convey the information to me, and then I meet with the patient and we go over everything again. So I'm not here.
Gotcha.
You go.
Gotcha. Sounds good. All right. So, Cassandra, for this, you're going to have some symptoms. Go ahead and just, think about some symptoms that you have for your back.
Okay, so originally it was tension in my right hip. And so if I didn't get adjusted regularly,
If I may just,
Yeah.
so pretend that it is truly a visit. Like, you come in, hey, I'm Dominic, who you are, and then you ask, do it exactly as you would do.
Yeah. So you just face me.
okay.
You guys aren't here right now.
Yeah.
Sorry.
Okay.
So, hi, Cassandra. What brings you in? I hear you have some low back pain today.
Yeah, so my right hip's bothered me for about 10 years. So I go to chiropractic adjustments. If I ignore it, then I feel it more like tense and tight in the area. And then I could feel it in my knee and then eventually my ankle.
Okay.
Yeah.
Anything happened 10 years ago when this all started?
Um, well, I've been in a car accident in Cali. That was about 6 years ago.
Okay.
And then like growing up, I was in taekwondo, like high school car accidents, but
Gotcha. Go ahead and
yeah.
describe this pain to me when you get it. How often do you get it too?
It's consistent if I don't get adjusted or stretch out my hip, which sometimes I lack because I get so busy. And so it just feels really tight and it feels like it can't move as much. And so I'll try to stretch it out, but a lot of times it doesn't help unless I'm getting like adjustments and stuff.
Gotcha.
Yeah.
If you had to rate it on a scale of 1 to 10, 1 being it's really not even there almost, you can barely notice it, to 10 is just the most excruciating pain.
Yeah.
Childbirth would be easier for
Yeah.
you.
When it's bad, I would say 7.
Okay.
Yeah.
Okay. And how often does it get bad?
I would say if I don't do chiropractic, it's consistently. If I do it chiropractic once a week, I don't feel it too much, but if I go later than that, I feel it.
Gotcha. Have you tried anything other than chiropractic that has helped? Any medications or any other therapies?
So I've done like yoga and Pilates just to try to get deep into stretching, acupuncture just to kind of release some of that tension, and then just stretching. That's about it.
Okay. Okay.
Yeah.
And does that typically provide relief? How far does it come down?
If I do stretching regularly with adjustments, then I don't feel it as much. But if I don't, then it's consistent. Like it doesn't really help. And I think it just makes me feel better in the moment.
Okay. Okay. Well, don't discredit that.
Yeah.
That's always valuable. Right. All right. Now, I know that a lot of times we kind of come in and we really get stuff started, but you have actually been fortunate enough to bring us some imaging of your own before you came.
Yes.
So has anybody gone over this imaging with you before?
Briefly, a chiropractor took that image. So he briefly kind of just stated there's 4 images. So he kind of showed me the problem areas that I wasn't aware of prior, and then talked about how it's curable. And that's about it, with a really high price tag.
I'm sure he wanted you to come in for a bunch of adjustments and whatnot.
Yes.
Which, that can work. There's definitely an angle there.
Yeah.
But let's see if we can go ahead and look at some of this imaging for us here.
Okay.
All right, good. So what we've got looks like it's an X-ray, and it definitely includes a lot of your lower back. We can see a little bit of the curvature here.
Yeah.
But what you're experiencing mostly is this pain in your right hip. Now, a lot of times with this imaging, it's of course right is your left and left is your right. But from this, usually we probably get some more updated imaging, but I'm not seeing anything that stands out immediately that says, okay, well, that's not doing great. So, of course, I'd like to start conservative. And have you ever tried physical therapy?
Back in the day, I've done it for a car accident in high school.
Gotcha.
Yeah.
Gotcha. And what did you think when you did it back then?
Well, it was paired with massage and other things, so I didn't necessarily know specifically for that, but I did feel a lot better overall.
Okay,
Yeah.
okay. I think I'd like to start there. Of
Okay.
course, that should be a lot easier than say chiropractics or whatnot, but
Mhm.
you're perfectly allowed to keep some of these adjunct things. I really do like the stretching and the yoga. That's going to play a large role into it, especially when you're doing at-home care.
Yeah.
Now, physical therapy, we're only going to do a couple of sessions before you come back and see me, but I really want you to get started with that.
Okay.
And then we'll sort of touch base there
Mhm.
because don't seem like you take any medications for it.
No.
So we're not going to start just yet.
Yeah.
So we'll see what happens after that. And then we'll get some updated imaging here in our clinic.
Okay.
Does that sound good?
No, I'm going to, now you and I, we are going to meet here,
Gotcha.
and discuss together, are you done?
Yeah, we're good to go.
Okay, now,
Okay.
you come to me and you describe that, do you mind to switch places?
Yes.
though? I'm going to talk to him now.
Okay.
Yeah, okay, that's good. Okay, go ahead.
So just for the record, typically patients that come in standard like this don't have to get elevated like this, but regardless, for this instance, I'd go, hey, Dr. Baz, do you have a second? I kind of want to run a patient by you.
Sure, for you to have a minute.
Gotcha. Okay, Sandra, I'm going to make up an age for you here, okay? So I had this patient come in yesterday. Her name's Cassandra. She's a 52-year-old female.
What?
I prefaced, give you a warning. And she's having this right hip pain. It started about 10 years ago. Rates at 7 out of 10 at max. It comes and it goes, pretty consistent though. She's tried chiropractics for many years and really got worse after a car accident she had about 6 years ago or so. She does Pilates and yoga, and sometimes that alleviates it, but she's recently seen a chiropractor to try and get some more consistent, and the price tag that he's offering her just really isn't going to do it for her.
Yeah,
She brought in some imaging, and I'm not seeing anything quite pathologic yet, but I referred her for some physical therapy, get started on that, and then she'll come back about a month after she started, and we'll get some repeat imaging. Just wanted to see what your thoughts are.
sure. What was the exam?
Fair. So there is a physical exam that goes with this because you want to rule out a lot of SI dysfunction and whatnot, especially when it's the hip. And then, of course, low back pain and hip pain seem very, very close to each other. But I didn't want to subject poor Cassandra to be poking and prodding her, especially if she's not paying me. So.
Oh, I see. Well, this is what I heard, that this patient is a 32-year-old patient in a childbearing age who had some physical activities, and did you say MVA, motor vehicle accident? Or
Yes, about 6 years ago.
6 years ago, and since then he's having mostly pain in the hip. But we need to look into more to see if it's radiculopathic or not, and as well what the rest of the exam is. And it seems that the patient has started some chiropractic treatment, but no physical therapy, bracing, or injection. But chiropractic treatment is not quite providing relief. Oh, you brought some pictures there. I see. Yeah, there is a little bit of a scoliosis to the left. It's not very severe. It's less than, I would say, less than 10 degrees. And as well, it's hard to say on these pictures, but it seems with 1, 2, 3, 4, 5, 5 lumbar vertebrae, pelvis is symmetric, sacroiliac joint, it doesn't look in the greatest shape. So differential diagnosis would be, mild scoliosis, lower lumbar facet disease, musculoskeletal pain, or sacroiliac joint. I think your plan is sound. Let's get all the non-surgical treatment scheduled. But as well, first thing, let's bring the patient for exam.
Cassandra, would you like to do a physical exam today?
So please sit square to me. The physical exam is the most important part of the visit.
Let's see. It might be having some trouble with table in the way.
No, don't worry about that. It's
Okay.
just, we're just going to simulate it anyways.
Sounds
I'm
good.
not going to do it now. First, I'm going to ask you to stretch your leg down. Now I'm checking out your gastrocnemius. Push down. Good. Toes up parted. No, that's tibialis anterior. Bend your knees 90 degrees and keep it bent. That is the hamstring. Now stretch it out like straight all the way. And that is nothing that.
That's right there.
No, gastrocnemius is here, but this exam, what am I examining?
Oh, or quadriceps.
Quadriceps. Now strength is full. does the pain, oh, by the way, I'm Dr. Abbasi, Dominic told
Surprise.
So, let's finish the exam though, then I'm going to ask you some more questions.
Okay.
Let me have the leg. Now, is that relaxed? Don't help me, don't actually resist. Is that painful when I bring it out? No? Okay, straight leg break sign is negative, which is a sign of lower lumbar, disc herniation, the foraminal stenosis, no pain there. Now we are going to do all the exam that we invented, the so-called rapid sacroiliac, combined rapid sacroiliac communication test. Can you do this here? Now hold it there, don't help me, don't resist. And if it's painful, let me know and I stop. Especially it's important in a woman, not 52 years, but 30 years, in childbearing age, because incidence for sacroiliac joint is 7 times higher within a few years after giving birth to a baby. Because baby has to go
Yeah,
past
traumatic.
through the pelvis, and every birth is traumatic event. And then that's the only time actually sacroiliac joint opens up for the baby to pass through. So it will be rough.
Okay.
3 push each time stronger.
Mhm.
They are validating this test in one of our studies. So don't resist me though. Ready?
Okay. Mhm.
Is that painful when I do this?
No.
In any
I'd
way,
say
in the
like
hip area?
tight, not
Tight,
painful.
some.
Yeah.
But not super bad.
No.
Okay, and I wasn't really trying hard either. So do the other side now. So you have to be really
Mhm.
tough. Sometimes you have to stand up and put your whole weight on it. Then one and then stronger and then stronger.
No.
No? Okay, so the sacroiliac projection is negative. Now, the pain you're having, does it go down anywhere in your legs?
If I don't stretch it out or chiropractic, I can feel it in my knee and in my ankle. If
So
I
it is,
don't get-
no, is it just the knee and the ankle, or does it come from the back radiating down to the knee and the ankle?
It could be that. I just always have just thought of this
Yeah,
whole
pay
section.
attention to
Okay.
that, I ask you
Okay.
next time.
Okay.
And it's when it's coming down, is it front of the thigh, L2,
Mhm.
3, side of the thigh, L4, or back of the thigh, L5? Which one is it most bothering you, front, side, or back?
Back.
Back, okay, so lower lumbar,
Yeah.
okay? Okay, well, I hear that Dominic has sent you for physical therapy. If the pain is less than 5, no injection is needed,
Mhm.
but for pain more than 5, injection could be an option, as well as bracing for those activities that provoke the pain.
Mhm.
That as well could be an option.
Mhm. Okay.
What question do you have for me?
On another image I brought in.
No?
No.
Okay.
She
Oh,
went back to the
Dominic,
chiropractor?
Dominic didn't tell me about the other image.
She got it today, I swear.
Oh,
If you go to the next one too. So
this is
he
sending
said,
from side to side?
yeah, he said that one's okay, but if you go to the next one, he said it's too straight in the middle part.
Mm-hmm.
What do you think of that?
Well, yeah, I would not consider these pictures in a significant way indicating any pathology by themselves.
Okay.
Now, certainly the X-ray, they can show certain pathological motion,
Mhm.
which mostly with what we call spondylolisthesis, when the bone in the front view here, if it moves forward and backward,
Yeah.
all I notice here is that literally the disc space is reduced here.
Yeah. That's yeah.
And then, but beside that, actually, I couldn't say, and certainly the sacroiliac joint, it is not the greatest, but sacroiliac joint never looked great.
Mhm.
So, and yes, here when you're turning from side to side,
Mhm.
I wouldn't put any on my part. I wouldn't put any weight to declare it in pathologic in any ways.
Okay.
Okay,
Okay.
but I do recommend to many times when we have a spine problem, it's we can counteract that by strengthening the paraspinal muscle,
Mhm.
which practically their job is to protect the spine.
Mhm.
If many times as well, people who work out, do
Yeah.
you work out, do you run?
Sometimes I used
Okay.
to a lot more.
Okay, those things are things that obviously puts more stress on all our joints, including the
Mhm.
spine. And I see as well a lot of young men, especially that they are very strong in arm and leg, but if you look at the paraspinal muscle, it's not at par with the, so the
Mhm.
arm and the legs can lift way more than the spine, and by doing that, they actually wear their spine from. So at this point, I recommend just more physical therapy.
Okay.
And if the pain get more than 5, injection could be an option. Bracing,
Mhm.
especially those activity like they have high frequency vibration, like driving a car, you know.
Mhm.
Nature really designed us to be 70 miles an hour. Now, when you are 70 miles an hour,
Mhm.
the paraspinal muscle 1,000 times a second have to readjust to this all this vibration. They
Mhm.
tire out.
Yeah.
So that for that same reason, a harder mattress is better than softer mattress for the same reason. Do you guys remember those water beds from
Oh my gosh.
they were horrible.
Right. What do you think of memory foam?
Well, memory foam is a new thing
Mhm.
that it practically distribute the weight more along.
Okay.
That is more like a texture thing. See,
Yeah.
there are two things in that when you are sleeping.
Mhm.
When you're sleeping, automatically every 20 minutes you change sides
Mhm.
because you don't want to stay on one
Yeah.
side because that causes what?
You know, you get a pressure sore.
Pressure source. Exactly. Your body, even if you don't remember it, does it all the time now. If you have a spine problem,
Mhm.
every time you do that, the pain wakes you up.
Mhm.
So memory foam, more or less, it reduces the focal pressure, it distributed better.
Mhm.
So probably you don't have to turn as often back and forth.
Mhm.
But the underlying mattress is that if it's very soft, it just with every motion, your body has to adjust to it. Has
Mhm.
those muscle, paraspinal muscles have to 1,000 times adjust to it. That they tire out faster. So in a way, probably it will help with the memory foam will help with the symptoms,
Okay.
but the firmer mattress actually reduces the overall stress to the spine and
Interesting.
paraspinal muscle themselves.
Yeah.
Okay?
Huh,
did
that-
not know that.
that's actually something I didn't know either. I have a very close friend who's had scoliosis, most of her life, and she used to say, "Yeah, I got to go sleep on the floor whenever she come over for a sleepover because it's just more fun."
Yeah, more firm.
Interesting.
Yeah, people who have back pain, they know that very well.
Mhm.
And if anybody who has slept on one of those water mattresses, carry the idea.
Some guy said, "I could just fill it with water. That it'll be cheaper, I promise, and then we could sell it for more."
Exactly.
So let's go back to my
Okay.
proper location. So what else do we need to talk about?
What do you recommend for like a brace, or you were mentioning something like that?
Now, there are 1,000 kind of different braces,
Mhm.
but if you can buy it in Walmart, probably is not the right. Now, the high-end braces is they are made that they used to be this turtle shell.
Mm-hmm.
They were horrible,
Yeah.
and they practically stop all the motion, and then your body didn't move, and the muscle actually they vanished away.
I can see that.
But the new braces, they allow you some level of motion, but not too much.
Mhm.
So they prevent motion that are really bad for you.
Okay.
For that reason, when patients come to me and tell me, "Oh, doctor, I hate that brace. When I have it on,
Mhm.
I cannot do this, I cannot do that." I said, "Then the brace is doing its job."
We don't want you
The
doing
brace-
that.
If the brace doesn't let you do that, it's probably a motion that you shouldn't be having. Okay?
It's good.
So what else?
Well, how's physical therapy been? I hope it's been going well.
Yes.
Oh, okay, well,
No,
wonderful.
physical therapy and chiropractor, they do a lot of good job.
Mhm.
Generally, we surgeon, we don't like those adjustments. That's general rule. We don't believe that there is much in our body that would preferably and favorably, respond to those adjustments.
Mhm.
But they do a lot more than the reflex therapy.
Mhm.
The posture control. Posture is extremely important.
Mhm.
And as well, in physical therapy, obviously, another thing that is extremely important is activity of daily living. One of the example I have is that Now you can bend down and
Mhm.
tie your shoes, or you can put your leg up or on your knee to tie the shoes.
Mhm.
You can achieve the same level of activity in your life without overstressing your spine. It's all what's about overstressing the spine. That those peak pressures is what actually damage our spine. Now, you told me that you jog or you run.
Mhm.
You know, obviously, mm, you have heard that there's a new trend that people walk bare feet, right?
I
Oh,
do that
yeah.
in Cali a lot, not so much here.
Yeah.
Yeah.
So, what something that we found out, our dynamic, our walking changes a lot when we the shoes, they reduce our feeling.
Mhm.
But on the other side, our feet are not made to walk on asphalt either,
Mhm.
Okay.
Yeah.
or sharp stone. Obviously, long time ago when we used to walk on our feet, our foot
Yeah.
was as
Callus.
big as the callus was as big as the horse's
Mm-hmm.
feet. Okay.
Mhm. Mhm.
We don't
Yeah.
have all of that, so we cannot walk bare feet, but we lose truly the feeling that comes
Yeah.
with the walking.
Mhm.
And as well, when we, especially when we run, those peak impact is what damage our
Yeah.
spine. Those peak
Mhm.
impact we have to reduce. Now, walking on grass, walking
Mhm.
on sand is hard, but it's
Mhm.
pretty healthy in your
Ah.
joints.
Hmm.
Interesting.
Walking on
Good.
grass is better than walking on asphalt,
Mhm.
and walking on a treadmill is better than walking on asphalt
Mhm.
because it has
Yeah.
like a little elasticity.
Mhm.
It literally reduces the peak pressure on the joint.
It's actually interesting you mentioned that because every time I visit my father, he's in the military and actually recently retired. We'll go to the gym together, and he will only go to gyms with rubber tracks. And
Mhm.
'cause sometimes they'll have those indoor tracks. If
Mhm.
it's not rubber, not allowed because they don't care about the people that go there. So
Yeah, and then obviously if you have to jog and run, buy the best the best kind of running
Mm.
shoe that you can.
Okay.
mhm.
Not only absorb the energy and give it back to you, but as well
Mhm.
it reduces the peak pressure.
Mm, mm, mm.
What are your thoughts when running on a treadmill, running at the highest incline? Right, that's what it's called.
Yeah,
It's a
incline.
class, yeah.
Is that okay?
Yeah, I don't
Okay.
believe that's really changed the
Mm.
Okay.
dynamic. That's
Mm-mm.
more for cardio.
Yeah, it just changes the location of your leg where you're working a
Yeah.
muscle.
Gotcha. Okay.
One of the things that people notice though, if they have spine problem, they rather walk up than walk down. Why?
Mhm.
I had actually recently entirely different tangent. It's from a novel I'm reading, but continue.
No.
I was very
want you
curious.
to tell me, or what do you think? Why, for people who have spine problem, walking down is harder than walking up?
So my thought is it's the impact of, when you're walking down, you have that moment where you hit down. All your weight finally comes down on this versus when you're going up, you gradually kind of ease into it more.
Yeah. Do you want to get our spine model?
Yeah, come here.
And I. So let's get rid of that. Stop sharing here. Okay. So
There you go.
imagine this is flat.
Mhm.
Imagine this wasn't flat and it was like that. So if it was like that, how would you walking? Like this, or like this, or like this?
Oh, probably.
You
Yeah.
walk like that.
back.
If you're walking up now, you're walking like this.
Mm, mm.
What is the difference between the foramen when you walk this way?
Far more
There are
compressed.
here
Mm.
holes where the nerves are coming out. When you're walking down, you're pushing your spine back, and that makes those holes smaller, those foramen smaller. Whereas when you're walking up, that opens up the foramen. So that's for that reason, it's actually easier for spine patient with the spine problem to walk up than walk down.
Huh. All right. Escalators down, stairs up.
Yeah. Now, another thing that, especially in the younger people, we always should consider, especially women, especially on childbearing age, is the sacroiliac joint. The study showed that about 25% of the time, when people have back problems, not their spine. It's really actually, if you had a previous surgery, that jumps up to actually 43%. Almost half of the people, if you have the spine problem, you see a back problem, almost half of the time you see a sacroiliac joint. That's a neglected child of the musculoskeletal medicine. Okay, so it's we are gaining a lot more knowledge now about that, now that we can fix it.
Mm.
Wow.
About that, that's a major player
Yeah.
in their musculoskeletal.
Mhm.
So, and as well, especially runners.
Mhm.
Now imagine, yeah, they were, there are few things humans are really good at. Otherwise, we are really bad at everything else. And like, did you know a mouse can win against the Olympic sprinter?
Wow.
Hey, Mouse Bolt, that's his name now.
Yeah.
That's crazy.
Have you seen a cat's reflexes?
Oh yeah. Oh
yeah,
my gosh.
On point.
Okay, have you, we human are pretty bad at running, you know, like
Mm.
if it was an Olympic thing with the like with the any in the animal kingdom, you know, you wouldn't even make to the kindergarten, to the preschool level.
Yeah.
Or Olympic gymnast wouldn't make it there. Or as well, look at all the animals. How far can they jump? They would laugh at us. They can jump like 20 times their
Yeah.
Mhm.
their
Size.
size. You know,
Yeah,
like
they
imagine,
leap.
Yeah.
imagine you could jump 50 feet.
Mhm.
That is the difference between
Yeah.
or
Or even a cat jumping from the base of a kitchen all the way up to a
Yeah.
fridge easily.
Mhm.
so we are not really good at many things, but there are two things we are really good at. We beat all the animal kingdom hands down.
Mm.
They cannot even come close to where we are. One of them is obvious.
Yeah.
We have podcasts, they don't.
Yeah.
Our mental capacity.
Yeah, I was gonna say that.
But our mental capacity grew because we were so bad at everything else.
Mhm.
We would hungry, we would starve. I mean, because we are not strong.
Mm.
Like, I'm going to tell you a story. It's a very sweet story. Like jaw, the strength of our jaw,
Mm.
compare it to any animal. We are ridiculous.
Mhm.
Like, let's talk about, for example, a cat or a dog.
Mm.
You give them a bone, they chew on it, they break it, and they're all happy sitting there.
Mm.
You try to do that, you knock all your teeth out. As a matter of fact, one of the reasons we are who we are, meaning human, is because of our deficit in all the other areas. Like,
Mm.
have you seen chimps and gorillas?
Yeah, oh my gosh, yeah.
Have you seen the skull of a chimp or a gorilla?
Ooh, no.
You should look at it because I think I want to tell you a story that is not about the spine, but I think it's a sweet story.
Yeah,
Oh.
they're pretty interesting, and they're pretty similar to the like earlier human skulls that we found.
I'm sure they have like massive incisors or something, right?
Hmm.
Okay, yeah. Okay, maybe I have seen this before. This looks familiar.
Oh, that's a human, that's not a chimp. But okay, let's just say gorilla skull. Okay, yeah, let's share it.
Okay, I've never seen a gorilla skull though.
They're massive. It's like anthropology, the other semester.
Oh.
Mhm.
These things.
Or you gotta click the share button at the
Okay.
blue at the bottom there.
So, when you see most of the skull of many animals,
Mhm.
obviously one of the important thing is that actually their skull is smaller.
Oh,
Yeah.
I mean,
spinous process.
the jaw, the neural skull is smaller. The jaws are huge.
Mhm.
Yeah.
And one of the things that you will see in all animals, including chimp, is this bone here.
Yeah.
What is that bone, Dominic?
Mandible? That one?
No, mandible is maxilla is here, mandible is here, but this one right here,
Oh.
this one right there. It is where your chew
So-
muscle goes through,
Yeah.
the masseter
Big
muscle
muscle.
goes through,
Is-
the zygomatic arch.
Okay.
Look how big it is. It is so big because it attaches to the mandible
Mhm.
and then it closes your jaw. And that's why a bear can crush any bone. You have so much, a gorilla, they sit all day long there, they eat on hard, woody material.
Yeah.
And this masseter are just, if you try to do that, you're literally, you get,
Yeah,
break
hurt.
your jaw and your jaw muscle are not strong enough for that. So what is the disadvantage of if you have such a strong masseter muscle?
Mm.
The masseter muscle is here.
Yeah.
It connects to your mandible. And then the other side is connect to your skull right there, like it fans out. But look at that masseter muscle. You see that masseter muscle now?
Okay, yeah, yeah.
Yeah.
It goes here. And temporalis muscle, masseter muscle, and so on. They go all through the zygomatic arch
Mm.
and they help you to chew. Well, but for every action is a reaction, right? So imagine you have a huge masseter muscle here, and it pulls the jaw toward that and it pulls against the skull.
Okay.
So this animal, if they're, when you're born, your skull is open. You know that, right?
Yeah, it
Your
has to
skull
fuse.
is not completely formed because your brain is still growing.
Mhm.
Now imagine you have a skull that is not closed and your masseter are pulling on it, it will crack open your skull and you will die.
Gosh, I can't imagine eating just like some jawbreaker and just
Yeah.
Huh.
If in these animals, by the time they are born, the brain is done. Because if
Mm.
it wasn't done,
They'd kill
couldn't-
themselves.
they would kill themselves the first time they choose something hard. Because it would literally, like an open book, open up your skull.
Hmm.
Now, human are born with the open and it closes around 7 years or something like that, that it start closing. In that time, brain can grow. But the fact that our masseter and jaw and chew muscle are not very strong make us survivable.
Huh.
And that was a genetic disease. The fact that our jaw couldn't, like of Duchenne muscle atrophy, right?
Mhm.
The Duchenne, do you want to describe what that is?
Oh, you're
Duchenne
definitely going to do a better job than I will.
Okay, so the Duchenne muscle atrophy is like your extremities, especially your leg muscle, they become weaker and weaker and weaker. People have to climb themselves up. They cannot walk because they are weak. The reason human is a human because we had a genetic disease that made our masseter muscle so weak, then our skull didn't have to be completely developed. Then it could grow after the birth. Now, when a chimp is born, can still climb.
Mhm.
When a baby gazelle is born, it's 2 seconds later, it's
Yeah.
running.
Uh-huh.
What can a baby human do? Not much.
Be a blob?
That's what we are. When we are born, we are a blob, but then we grow because our brain is developing. Okay, our brain is not done by the time of the birth. But if our chew muscle was strong enough, we wouldn't survive that. And so you see how a disease became an advantage for human.
That's fascinating.
So we were talking though about the spine.
Mhm.
So the fact that we have our intellectual capacity, we owe that to a genetic disease that make our chewing muscle. We couldn't. Okay, and it comes handy. You see, it is not strong enough. It's not going to split open your skull, but it's not strong enough for you to go and kill an animal with your teeth. Then you have to find another way.
Yeah.
If those that found a way to kill an animal with their brain or something.
Yeah.
No, this is one of the things we are good at. You remember I told you we are 2 things
Mhm.
humans are good at. this wasn't related to spine much, but the second one is related to their spine. What is the second thing human beat every animal hands down?
I feel like I got a pretty solid hint with the spine, but I still,
No idea.
yeah.
What is the difference between you and other animals when regarding your spine and walking?
Oh, that we're
Bipedal?
bipedal.
You're bipedal, exactly. What's that? Now, many of our spine problem is because we are bipedal and our spine has this multiple. When a baby is
Mhm.
born, their spine looks like a C.
Yeah.
Guess what? For most of animals, spine looks like a C.
Mhm.
Interesting.
But we are upright. Our spine is not a C.
Hmm.
It's a S.
Yeah.
Mhm.
We need those curvature for our spine to work and for us to be standing up. But obviously, it gave us some advantage because nature doesn't try useless things. Okay.
Mhm.
What other animals are bipedal? Not birds. That doesn't count.
Yeah. I'm trying to think.
I mean, the only ones
You
that
see the chimp walking,
Yeah.
brief
they're
periods.
very uncomfortable.
Yeah, yeah. The only animals that are
Knuckle walk.
yeah, that's
Yes.
exactly it. Any other animal that I consider bipedal is really either like, some sort of insect or it really only does it for a small period of time.
Oh, I mean, I'm talking
Yeah.
about the. No, let's talk about mammals.
Mammals, yeah, yeah.
Okay.
So
So which other mammal is bipedal?
I've got 0 answers.
I thought of a bear, but they don't walk on their
Yeah,
2
it's-
feet,
They
they
can,
just
they can.
stand.
They can to make
Right.
themselves taller.
Yes.
For the same reason, humans stand to make themselves taller.
Mhm.
Why do the bears stand to make themselves taller?
If you're larger,
Number one,
Yeah,
more.
appear larger.
intimidating, to see more.
To see
without
more.
moving.
You see more in Savannah, where we are from, in Tanzania,
Mhm.
there are tall grasses. If you stand up, you can see farther.
Oh, like a little
That's huge
meerkat.
advantage. Like a meerkat.
Yeah.
But see, the meerkat, it stand up only to walk,
Mhm.
okay? But then it come back and
Yeah,
walk
yeah.
on four.
Mhm.
All other animals, there's a theory that we killed all the other bipedal animals
Hmm.
because they were our direct competitors.
Okay. I mean,
That's why we are the only bipedal animal.
yeah, we all
okay?
competed them.
Yeah, well,
Our
no, we
slaughter
literally
them.
killed them. We literally killed them.
Oh.
And partially, we sometimes even ate them. Good. Yeah, good
Hey.
job.
Got to do what you got to do, you know?
Still, they eat like chimps and gorillas and so
Mhm.
if they get them.
Yeah.
I mean, hey, yeah, when you're hungry, you're hungry.
Mhm.
Gotta-
Yeah, when I'm hungry, you look
Yeah,
delicious.
yeah, exactly. What can you
So-
say?
Nom, nom, nom. Okay, so, but standing up, looking further is a huge advantage.
Mhm.
Now imagine you can stand up and look around and even move.
Hmm.
That's a
And
tremendous,
balance.
Yeah.
tremendous advantage.
Okay, it's kind of interesting because it sounds like we're
Why?
able to absorb more information, but we're also one of the unique animals that has the ability to process that additional information.
Yes, all that goes together, but see, why is it walking on 2 feet is so much better than walking on 4?
I feel like you have your hands open, so you can.
Mhm.
go
And use your
more.
hand, yeah.
These bad
Yes,
boys.
you can look further,
Mhm.
but there's another reason too.
Oh,
Now, have you seen a horse gallop?
Yeah.
yeah.
If you look carefully how a horse is galloping, it keeps the motion, it keeps the energy of the motion. You know, you don't want to go with your whole body much up and down.
Mhm.
You literally want to keep the body at a certain level
Mhm.
and use your legs like almost like a wheel.
Mhm.
Okay, that is how they're galloping. They do that because it's very efficient for them.
Okay.
Not when we run, but when human walks, it is the most efficient mode of transportation that nature has improvised.
Mhm.
No animal ever have or will or is as efficient in walking, with meaning more miles per calories
Mhm.
than human.
Interesting.
Huh.
Not running, walking.
Okay.
We are walking animals. We are made to walk. We are a walking machine. We are a
Hmm.
genius walkers. We could, as a matter of fact, there is still a method of that how they hunt in Africa. they just walk behind the gazelle. The gazelle runs, then human walks, they run, the human walks, and we heat exhaust them and they die of heat exhaustion, and we go and eat them.
Wow.
Not a very good meat because the animal is stressed, but
Yeah.
Yeah.
Hey, when
But-
you're starving, everything's
Yeah.
good meat. You know?
Yeah. So, but mile for mile, we can walk more efficient than any other animal.
Interesting.
Because again, the same thing, like the galloping thing, we swing our legs, we use the energy, and guess what? That is where all the feeling in the legs come from, you know?
Hmm.
That you coordinate that, you know? Have you seen a baby walking? What's the difference between a baby walking and a regular walk?
Oh gosh, it like stumbles and stuff.
Yeah,
Yeah.
that's stable.
Yeah, it's no, look at the baby when they're walking. Every time they walk, the whole body goes up and down, up and down, up and down. That's not efficient. That's what most of those animals who are bipedal, when they walk like that.
Hmm.
Now the chimp, they compensate by that by swinging from side to side. So
Mm.
the body would go up and down, but they compensate for that. Let's watch a chimp walking. What do you see?
Oh, that'll make me happy.
Yeah, that is
I'd like to see that. Yeah.
YouTube. Thank you, YouTube.
See a little chimp walking. Does it want to show us one? Oh, here we go. Okay, he's doing a little spin. Oh, here.
So do you see
So much
how
fun.
uncomfortable it is?
Yeah, there's a
Look
lot
at
of
the human,
swinging
Look at
there.
the human. Look at the markers.
Hmm.
Okay, and we swing our arms to literally compensate. Now look at how much up and down it goes, and he's compensating by swinging from side to side. Do you see
Yeah.
that there?
Mhm.
Well, thank you, YouTube. I wasn't expecting to get
I know
that.
this is
My
exactly.
whole point made for me just that easily.
Wow. Honestly, can we, if every search result turned up that easily,
You're
that was perfect.
Yeah, well,
Interesting.
so that is the second thing you're really good
Hmm.
at, walking. So when our patient asks us, doctor, what should I do? Should I walk? What do we say?
Walk.
Small, frequent walks.
Mhm.
That's the best you can do. Running,
Ooh.
not that
Not
much.
necessarily.
Yeah, yeah. That high
Because of
impact
the peak
stuff.
pressure,
Yeah.
Mhm.
pressure that it produces. Let's go back to that. Our body is not made to run.
Mm.
Our body is not made to swim. Our body is not made to climb, but our body is a master of walking. Okay?
That's actually a very perfect point. I'm going to use that whenever somebody tells me to hurry up, run over here. I'm like, well, sorry, I'm a master of walking.
I will
Nothing
walk
else.
over it. Yeah. And it's healthy. That's our body needs. When you stop, but that's another thing that we, especially our elderly patient, we need to keep them walking.
Mhm.
When an elderly defined 75 and older quit walking, for whatever reason, completely quit walking,
Mhm.
their life expectancy is shorter than if they're diagnosed with cancer.
Really? Wow.
Yeah, because your body shuts down.
Mhm.
We just had a patient and we saw that patient just yesterday. No, there's a good news. Good news on that patient is that he stood 2 months ago. I think that's important. There obviously no name, but
Mhm.
describe what happened 2 months ago. We talked about that before, but
Yeah.
and
Yeah.
all of that happened because he couldn't walk anymore.
Mhm.
Go ahead.
So this was wonderful person, just angel sent from above, come down to mortal earth. Anyways, regardless, unable to walk and no sensation below, and just unable to take care of themselves. Couldn't stand up to shower or bathe or any of this stuff. So this isn't a person who's dirty. This is a person who can't clean themselves.
Mhm.
And so he comes to us, wheeled in to our OR, and then immediately after surgery, probably an hour.
Yeah.
It was just like that, after being turned away from so many other people because he had some significant other deformity farther up in his thoracic spine that everybody else is concerned about. But really, he has something in his lumbar spine, one level. That's what making it so he can't walk. And nobody would touch him. And he comes in. Hour later, comes out, he's waking up and he says, oh my gosh, my legs don't hurt.
Yeah, we should talk about the
Yeah.
other abnormality because that was a significant. He had
Mm.
35 years ago. By the way, we took the testimonial of this same patient,
Mm.
and please ask Charlie to put a link there. Charlie, put a link of that patient testimonial out there.
Mm.
A farmer. Farmers are hardest working people.
Mhm.
35 years ago, he falls from tractor, he breaks his spine,
Wow.
Mhm.
and at that time, it doesn't get fixed, whatever the reason is.
Yeah.
And his spine, thoracic spine, is like broken, and but it grew in the broken status. I mean, it broke, but then it grew together in that bad status.
Mhm.
Well, he's a farmer. He went and lived another 35 years with that back.
Yeah.
It grew together. Wherever he goes, including some big names here close to us,
Mhm.
everybody wants to fix that thoracic thing because there is glory in fixing something like that.
Yeah.
You can go and show the picture in the conferences,
Mhm.
and you know that see what I did. It was like this degree, and now it's straight. How
Mhm.
the patient doing? Not that
Yeah.
important. But come
Yeah.
here, Dominic, please. But he goes to those doctors. Stand up, please. He goes to those doctors. They say, "Oh God, we have to fix this. We have to fix it." But he says, "Doctor, I have no pain there. My pain is down here,
Yeah.
and it's going down to my feet.
Mhm. Mhm.
I have no pain there. Why do you want to fix that?" "No, we have to fix that. We have to fix that." And I saw the patient about a year and a half ago, and the patient has additional to the broken bone in the back. It has the grade 2 L5S1 spondylolisthesis, meaning the bottom disc, which is far away from broken bone, is actually shifting,
Oh,
and that is what's giving you symptoms.
right.
The symptoms from the back here, yeah. So the patient has a broken bone here. This place here, it grew like this, but he has been working with that 35 years. Now, bottom one here, this is slipping forward. That is actually what's giving his symptom. That's what prevents him to walk.
Mhm.
That's why his feet are going numb.
Mm.
And so he practically comes to us, and we set him up. No, everybody else told him, no, this has to be fixed.
Yeah.
This, everybody does it. I cannot present it in a conference, say how glorious I am.
Mhm.
But this one, oh, this has to be fixed.
Right.
And he came to me and I said, yes, it is bad, but this is going on for 35 years.
Mhm.
This is causing your symptom, and the proof of that is he wakes up, he can feel his leg again. Where we
Wow.
fixed only the bottom disc in less than an hour,
Yeah.
and we sent him home actually same day.
Mhm.
Now he had lots of problem because he hasn't walked for so long.
Mhm.
He had the condition, so he had to go back to a hospital. It's very interesting. The same
Yeah.
doctor that they told him they cannot fix that,
Mhm.
the
Yeah.
bottom one, they told him, "Oh, this should have been fixed. This should not have been." But he's telling them, "But doctor, my leg pain is gone. I can feel my leg.
Mm.
Now I have no other problem, because I haven't been walking for so long." What is the obsession with fixing that? The obsession is very clear.
Mhm.
That is something you show in a conference.
Yeah, give yourself a pat on the back for that one.
What the patient is doing with that surgery, where you have to go open up the patient from the front and back,
Oh, wow.
60% more, complication rate,
Mm.
25% risk of infection,
Mm.
and so on.
Mm.
Then I've actually made a TikTok about that, another patient that it look horrible, but has no symptoms. And I'm telling him, no surgery, you don't have any symptoms.
Right.
Now, some surgeon would go and want to fix that,
Mhm.
Mhm.
but then the best way to fix the picture is to Photoshop. Actually, on the TikTok, I go and fix that in 30 seconds. I fix the problem. Okay, it's fixed now.
Mhm.
The idea of fixing patient and fixing pictures is another new idea here.
Mm.
And but one of the things is when I put a picture in LinkedIn, lots of, especially younger people, they jump, but they have a diagnosis, they have a plan, they have already made the plan for the second and the third surgery already.
Mm.
Wow.
Very few of them, and mostly very experienced when they ask, "How is the patient doing?
Mhm.
What are the symptoms?"
Mhm.
Mhm.
And that is what I think, it's extremely important to understand that When we age, our spine age, not everything that look bad on the picture need treatment.
Mhm.
And this patient that we just treated is example of that. But where we started is about how important it is for you to walk, because that patient wasn't even an old patient.
Mhm.
He's in his 50s,
Mhm.
probably.
Wow.
And he stopped walking for 6 months.
Yeah.
He could pant, he couldn't take he couldn't take a breath. He couldn't just move going from one chair to another because
Wow.
he was the condition so bad.
Mhm.
And the OR,
Yeah.
it was sad. We found dead bugs in his skin
Mhm. It
because he
was-
couldn't take care of himself.
When after you see him, actually, I had begged him on the phone before because I had talked to him so many times. When you come here, just please wait. I need to see you in person again. You know, and I had caught up with the lobby, and he was telling me just how, and it broke my heart because this is something you don't think about. He was so happy that he was able to stand. He was over the moon about these. I haven't been able to stand.
For 6 months.
Yeah, and he's just like, everybody keeps telling me, well, when are they going to go back for the rest of this back? He goes, well, who cares about that? Look at what I can do now. And
So what would you say that if somebody from one of these big places told him you did the wrong thing? How do you answer to that? That he couldn't walk now, he start walking again, he feels his leg again, his pain is gone. Now, they said to him that we did the wrong thing. We should have fixed that 35-year-old thing that he has been using for 35 years old. So not even afterwards, seeing that the patient is getting better, are they willing to admit that that was the right thing to fix?
I did have a small argument with the radiologist who was asking that very similar question. He went, so why aren't you guys going to do that? I said, oh, well, what symptoms does he have from that?
None.
Well, I don't know. Okay, well, if you don't know, because I just talked to him and he's doing great. I don't know why I'd want to go back in there. But
Well,
Hmm.
the idea is here that, you're becoming, it was a time we didn't have films. You have to talk to the patient and, treat the patient, like examine the patient.
I'm sorry, I was trying to spare you.
Oh, nice picture. What are your symptoms? Where is the pain?
Yeah.
So I think the idea that we look at the picture and we have the whole story is a new idea. For hundreds and hundreds of years, we used to for us to get the information, we had to talk to the patient. And now we are the most of surgeons, spine surgeons becoming photoshoppers rather than clinicians. That is a problem.
Yeah, because I can see too, it's like a lot of times they're like, this is what the normal spine's supposed to look like. But if it's off or anything, it's like you need this and you need that versus being like, okay, some people have this, some people have this, and it's nothing that's going to compromise, your walking or your abilities or anything like that, your daily life.
Well, I think we came a long way. We had a simulated patient. We
Thank you
talked
again.
about
Yes.
we talked about that the process how it goes,
Mhm.
and then we actually wandered around a lot. We talked about the bipedality, how
Mhm.
it comes, about the two advantages human have, and why we have how we not we but the nature turned a genetic disease and made us because of that. And then as well about, the personal story of a patient that we helped recently.
Yeah.
We should put that testimonial out there because I think the people who are the Photoshop doctors, surgeons,
Mhm.
they should watch that and maybe there should be a walk of shame for that. If not even afterward, when the evidences are in front of you.
Mhm. It
You'll
reminds
be
me
able
of,
to admit that you were wrong.
it reminds me of back in high school, this was a chronic problem in my English class. Somebody would either read one chapter or the synopsis of a book and then they try and write a report on it. You got to know the whole story. You can't just go for a couple of pages and call it a day.
Yeah. Well,
All right.
it was a great discussion.
I've been Dominic Moore. This is Essence of Medicine.
I'm Dr. Abbasi.
I'm Cassandra.
Thank you for being with us.